All right. So, standard 4.4 is I can identify common newborn reflexes. So, we're going to talk about different reflexes that newborns have at birth, their purpose, and why they're important. You will need to be able to recognize the different reflexes. So, your essential question for this standard is what is the purpose of newborn reflexes? Go ahead, pause the video, write down that essential question, and then come back when you are ready. All right. Okay, newborn reflexes. Reflexes are survival skills for the newborn and a way for the physician to check the functioning of the baby's neurological system. The neurological system is how our brain works with our body. So, many of you might have been in a position like this when the doctor hits your knee and then you kick involuntary. That's a reflex. Okay. There are specific reflexes that newborns are born with that help them to be able to survive. We're going to talk about 4 of those today. Okay. First one is called rooting. Rooting is when the baby's cheek is stroked, the baby turns toward the side of their face that was stroked. This helps the baby when learning how to eat and being able to find things. Okay. So that's called rooting. I'm going to show you an example of a real baby doing rooting. Okay.
Okay, there you go. Okay. It's got a good suck. I'm looking for that. That's a good suck. Okay. We can actually demonstrate a root by just stroking the side of the face. It should seek for that. Yeah, seeking for that, and that's a very good root reflex. Just looking for that. Okay. Very good. Okay.
All right, so that's rooting. Just so you know, sucking is also a reflex that newborns have. You don't need to know that one. You're not going to be tested on that one, but that's why you saw the doctor talking about that one as well. Okay. So the next one you need to know is called the Moreau or startle reflex. This one is stimulated when there's a loud noise or a sudden movement, such as when the arms are held and then suddenly released. It causes the baby to throw their legs and arms out with clenched fists, and then they slowly bring them back into their body. Okay. So again, I'm going to show you what a Moreau reflex looks like. Here we go.
You can elicit the Moreau reflex by having him relax, unsuspecting, and then give him a sudden stimulus. And there's a good Moreau. Quiet and head midline. And then just give the stimulus of dropping him back a few inches. And that's a good normal response. Okay.
Okay, so that's a Moreau. Notice the doctor still supported the baby's head. Okay, we're not just like throwing the baby, things like that. Moreau startle reflex. You might have seen that with a newborn before. The next one that you're going to learn is called the Babinski reflex. This is when the sole of the foot is stroked from heel to front, the toes will fan out. Okay, so you stroke, so pretend this is a foot. If you stroke from heel to front, the toes fan out. Okay, so I'm going to show you an example of this one too. Here we go.
Testing the Babinski reflex in infants. The Babinski reflex can be tested in infants by firmly stroking the sole of the foot with a finger or a blunt object along the lateral side from the heel to the toes. Typically in infants, a tonic dorsiflexion of the big toe as well as a plantar flexion and spreading of the small toes occur together. This is known as the Babinski sign and is physiologically present in infants until between 12 and 24 months of age. Afterwards, the sign may indicate damage to the corticospinal tract.
Okay, so that's the Babinski. I know, we're just coming up with awesome words. Okay. Next, we have the grasping reflex. The grasping reflex, most of you are probably familiar with this one, is that when an item is placed in the palm of the baby's hands, the baby's fingers wrap around it, right? This is why these babies can be very strong. Some babies, you can kind of pull them up a little bit with their grasping reflex. So here's an example of that.
Look at the position of the hand should be able to open and close, but most of the time it is in a closed state, but not a tight closed state. We can elicit a grasp reflex by again putting the hand right there and the thumb, and again the baby is able to grasp. We can open the hand by stroking the side of the hand, and then just stimulating a grasp reflex just by again putting the hand right there and having a grasp reflex. Okay. Now I'm seeing a good grasp reflex there. This is a good grasp reflex there. In fact, you can simulate the grasp reflex and then lift the baby. If we can get it quiet there, you can see he's almost pulling himself up as far as the grasp reflex and able to hold on with that hand. As far as just putting pressure here at the ball of the foot, and the toe should come down in a flexion, which he does. And should grasp, let's look over here. And you can see that there's a grasp reflex.
So grasping reflexes are also with the toes, not just the fingers, okay? But that's the other reflex that you'll need to know. All right, I will see you in the next one.